We have everybody here. We can open up the meeting. Mr. Chairman.
All right, make a motion to accept the agenda for the Scituate Board of Health, Monday, May 11th.
Second it.
All in favor? Aye.
Aye.
Okay. Schedule items. Discuss and vote homeowner application number 6 for Community Septic Management Program, CSMP Septic Betterment.
Okay, so we have a failed system that the owner would like to use the betterment for. And so originally, you're approving up to $25,000. He doesn't think he'll need it because they're trying to keep the tank. But he won't know until he gets all of his estimates. He's only got one so far. So Morse Engineering has said that they are in failure, so he's confirmed that, so they are eligible for the betterment because they have a system that's in failure. I think we should approve it up to $25,000.
Okay.
Okay.
If you will.
Wendy, you want to read the motion?
Yep. I make a motion to accept homeowner application number 6 for Community Septic Management Program, known as CSMP Septic Betterment.
For $25,000.
For $25,000.
Second it.
All in favor? Aye.
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 Here we go.
Okay, one
Okay. Discuss and vote homeowner application number 7 for Community Septic Management Program, CSMP Septic Betterment.
Okay, so right after we got application number 6, we got application number 7. So application number 7 is also in failure, and that was confirmed by Rosano Davis. They do have a plan that's approved through the Board of Health. So they want to use the betterment program for this because they're starting to get estimates and they're realizing that they need some money. So with this last betterment, really only are going to have $20,000 left. I did tell her that, the owner of this house, but I said number 6 or number 5, if that doesn't use all of their money, then she will have up to $25,000 for hers. So she was in agreement with that. I think we still should approve it up to $25,000, but we'll make sure we don't go over the total $200,000 that the town had approved for us to get a loan through the state. So if you want to approve it up to $25,000, she knows that she might not have up to $25,000. Does that make sense?
Yeah.
Yeah, makes sense. Sure.
Okay, I make a motion to accept. What's that?
No, go ahead. Sorry.
Oh, wait. Okay. Motion to homeowner application number 7 for Community Septic Management Program, CSMP Septic Betterment, for up to $25,000.
Second it.
All in favor? Aye.
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 Okay.
And I do want to tell you that this will probably be it for our septic betterment. I did talk to Nancy Holt, and we have to put a request in the fall, put it on town meeting for next April. So we'll still be able to take applications, but they'll be on hold until the money gets approved through the town.
Okay. Makes sense.
Okay.
All right. Number 3, discuss and vote well permit application for 537 Hadley Road, requesting variance of Scituate private well regulations.
So this is Sue DePeza, who is looking for a variance from the Scituate private well regulations. She has an irrigation well that she wants to use for watering her yard. She is near the golf course. She has met all of the requirements for the well, except on some of the items that she's looking for variances for. So G&L Lab did the testing. She passed on everything except for pH, iron, and sodium. All 3 of the items are more, it's for odor and, taste. It's not necessarily a health disparity that you're going to get from drinking the water. So with that, I'm just going to see if Sue wants to add anything to it. We have given variances in the past for these items. I believe this is the first one where we have all three of them, though, but we have given these in the past. Sue, anything to add?
No, Drew, thanks. Just really that we're not planning to use it for drinking water at all. We're just using it for the irrigation. And we did try to correct, see what it would cost to correct those items, but it was prohibitive in cost.
Okay.
I'm going to make a motion to grant a variance. This is
Sure,
for
yeah,
private well
yes.
regulation for 537. What's that?
No, I was just going to say, I have no problem with it as long as it gets tested and it's used strictly for irrigation, which it would be hooked up that way. So I don't have a problem with it.
Okay.
Did you read the rest of the motion? I'm sorry.
Oh, can I just make one?
No. Oh,
Yeah, go ahead,
One
John.
comment.
Yeah.
So the regulation says that you have to test your water every year. So we recommend you test it in the spring before you're going to be using it for irrigation, just to make sure it's
Okay.
okay.
is she required to submit a report, Joan?
You don't have to. Yes, you still have to, but you don't look at the regulations because you don't have to do the full. You don't have to do everything. There's like certain things that you have to do, but it's very limited on the things that you have to do every year.
So when you want to have this tested again, Sue, get in touch with me and I'll go over the regulations so you know exactly what you have to get tested for when we do it in the spring.
Okay, so it'll be a year from now.
Yeah.
Yeah, okay. Hopefully we'll be out of the house by then.
So do we?
Are we ready?
Yeah.
Okay. I make a motion to grant a variance from the Scituate private well regulation for 537 Hatherley Road for iron, sodium, and pH only. With the recommendation that they abide by the guidelines.
Second. All in favor?
Double second it.
Aye.
In favor, yes. Aye.
Double second, I like that.
All right.
All right.
Good luck.
Thank you very much, you guys. Yep.
Thank you,
Thanks.
Sue.
Bye,
See you
Sue.
soon.
All right.
Bye-bye.
Thank you.
New business, director's report.
So with COVID-19, the epicenter of everybody's life right now, Situate's no different than any other community. We have been hit with COVID-19. Our most vulnerable population, which are the seniors in homes. We have two of them in the town. One of them is doing very, very well. We haven't had any real issues at all. The other one, we do have a cluster down there. We have in excess of 20 cases currently down there, and staff is working with the state. They have tested all of their patients currently, and we are still awaiting results to be coming in from those tests. Also, all of their employees are being tested. Over the next 2 weeks, they'll be tested gradually. They don't do them all at once, because if they have a massive case where everybody has it, now we have no one to care for any of the patients in the nursing home. So the state always recommends that the employees get staggered a little bit when they get tested. So excluding our nursing homes, we do have 90 cases in the town. 85 or 81 of those cases have completed the 14-day isolation period. We have had 4 deaths in the town, unfortunately, and all our prayers and sympathies go out to the families who have lost ones to COVID-19. We do have, out of the 90 cases, 5 cases that are currently in isolation. 2 of those cases will be coming off of isolation tonight at midnight. Another couple of items to talk about is the state came out last week with mandatory masks. So that is now in full effect in the town of Scituate, mandatory masks for anybody going into a business. If you work at a business where you cannot socially distance, you need to be wearing a mask, and we are getting calls to go and check on these places. One thing people should remember is if you see someone without a mask and they are in one of these establishments, there is a good chance that the individual has some type of medical condition. We cannot ask them what their medical condition is. All we can do is ask them if they have one, and if they say yes, then they are not required to wear a mask. We are hearing stories of, people calling out people who don't have a mask on, not really knowing the full extent of the law, where there are exceptions to that. And, a good case is if someone has asthma, they can't be wearing a mask for 6-7 hours at a time. They just can't do it. So there are exceptions to the mask rule, but if you do come across anybody that isn't and you want us to check it out, by all means, call the Board of Health, and we will be going out there. I'm actually going out to check on a couple tonight when I leave here. We also, marinas have been opened up for the season. There are guidelines for the marinas that must be followed. Within the past week, golf courses have also opened up, and there are also guidance for the golf courses that must be followed for social distancing and all of that. So those are 2 areas of business that have reopened. We are glad that the golf courses have opened up. We do generate some revenue from Widows Walk, so we're excited about that. Other than that,
True.
Yes.
I think it is important to say a mask if they can't socially distance 6 feet
Correct.
between them.
Absolutely, yeah. If you can't, it is 6 feet. You're absolutely correct, Wendy. 6 feet. Was that Wendy or Joan?
Wendy.
Okay, yeah. You have to be 6 feet. Currently, right now, myself and Doug and Seth are here in the town council room, and we all have our masks on. So we can't sit 6 feet apart, and Doug and I are sitting here looking at each other with our masks on. Doug looks very handsome. So it is.
But just for people outside, because there's a lot of comments that people are out walking, without a mask, or people are getting upset about that. And if they are 6 feet or more apart,
then they do not need a mask outside.
Yeah.
If they can socially distance 6 feet apart outside, if you're going for a walk, that's completely acceptable. There's nothing against the law that would do that. Obviously, if you're, on the marina side, if you're going to or from your boat, we require that, part of the guidelines are that people have to wear masks all the time while they're on the docks, the gangplanks going to and from. So the mask is critical right now. People should be wearing them if they're going out in the public, if they are going out to the grocery store, if they're waiting in line at the grocery store, people should be having their mask on. Does anybody else have any?
Do we have signs that they can put up in restaurants or convenience stores?
We have gone out with signs early on regarding social distancing. I know that we are currently, I spoke with Steve Moan, the harbor master. He's in the process of getting signs together for the gangways and the docks for people to wear masks on. So we're in the process of putting those out there too.
Okay.
With that, we are still doing the regular daily work over at the Health Department was still taking in plans, reviewing plans, and going out and doing inspections on plans. I actually did 5 inspections today on septic systems that are in the process of being put in, and I'll make sure I write them all down in my book, Joan, so we don't forget any of them and have Teresa get on me. So that's where we are. I would like to just say, you know, we do have a public health nurse, Eileen Scotty, and the amount of work and time and effort that she has put in over the last, 8 weeks, doing contact tracing and checking in on all of these individuals that have tested positive is just a monumental task, and she's just been tremendous handling it. I just can't say enough. And for all of the hard work that Joan and Teresa do day in and day out, remotely, still coming in, making sure that bills get paid, making sure that, things get notarized, deed restrictions get put in place. These are all things that, on top of everything that they're doing with COVID-19, they're still doing their regular work that needs to be done so that people can move forward with their lives during this isolation period that we're going through. So with that, I'd just like to thank everybody at the Health Department. They've just been fantastic, and all the coordination and cooperation that we've had through all of the town departments. So that's the director's report tonight.
And
Great.
I'll second that you guys have been, through the tough parts, and appreciate everything you're doing. It's not
Agree.
easy. Any old business or other business?
Looking for a motion to adjourn.
Motion to adjourn.
I'll sign the invoices, guys, so you don't need to come in.
Right that.
Oh, good.
Second? All in favor? Aye.
Aye.
Thanks, guys.
Thank you so much.
All right, thank you. Stay
All right, good
safe.
night. Bye, guys.
Bye-bye.